is WZRD Chicago 88.3 FM. And we have with us at WZRD Mark Jacquot. He is the Chief Operating Officer at the Juniper Center. Welcome, Mark.
Thank you, and thanks for having me.
Thank you so much. Mark, uh, you work in the Juniper Center and the Bridging the Gap Collective, which are let's you describe them for us first.
Of course, of course. So, first of all, the Juniper Center is a group mental health practice. We have 6 locations throughout the Chicagoland area, as well as a telehealth presence throughout the state of Illinois and in Northwest Indiana. We have been in existence for a little over 25 years, under the Juniper name for about 15 years. We've got close to 80 therapists working with us, including psychiatrists, psychologists, nurse practitioners, social workers, family counselors, licensed professional counselors. So we really do try to offer as many services as possible to the clients who are out there. So that's the Juniper Center. And then our charitable arm is called Bridging the Gap Collective. Bridging the Gap is a charitable organization really focused on providing services, mental health services to people in underserved communities. So a lot of people who have need that either don't know where to go, don't know how to find us, or simply cannot afford care, we're there for them. And we are beginning to get into communities now and reach out to those folks who may need us the most, but may have the least.
You started off in the field of optometry in your career. How did you make the switch to mental health?
Right. Well, thank you for asking. So it's an interesting saga, I guess. Interesting journey. Yes, I started out as an optometrist. By the way, I started my my undergrad career at Northeastern, and went on to optometry school. Was in clinical practice, and then ultimately on the business and administrative end of things for the majority of my career. I actually retired from optometry a few years ago and began doing some consulting. The owner and operator of the Juniper Center, Margot Jacquot, who was my younger sister, asked me to come on and work with the Juniper Center to help expand the practice, grow a little bit, see how we could reach out to more clients. And so I've been working with the Juniper Center now for a little over 3 years. It's been a neat, interesting transition. I've been in healthcare all my life, but this is a different facet. And right now, I feel like we are really meeting a need, a really huge unmet demand that's out there for mental health services. So really enjoying this transition and working in the mental health field, kind of behind the scenes, as I'm not a therapist, but I'm enjoying it immensely, and we are really doing some good things, I feel.
So you are you have in charge of increasing the coverage of the Juniper Center and its charitable arm, Bridging the Collective.
I'm on the board for Bridging the Gap Collective. I'm on the executive team of the board. In terms of my role with the Juniper Center, I oversee a lot of the back of office functions. So certainly practice operations, finances, human resources, yes, recruiting, making sure that we have enough staff to meet the needs of our clients and patients. So I really have a hand. I wear a lot of hats, and I have a hand in a lot of different things. Marketing is one of them, and it is they're again, as the practice has gotten larger, we have had need for more back office support to make sure that we're not only serving our clients, but also our therapists who are working so hard to take great care of their folks. So I have a lot of functions that I work with right now.
What years were you at Northeastern Illinois University?
Okay, I guess I set myself up for that question. So I started there in 1978, and then in 1980 transferred down to University of Illinois in Champaign. Graduated optometry school in 1987. So I've been around for a little bit. But yeah, it was a while back. And I do have fond memories of Northeastern. My older son actually went there for a while and is still pursuing his psych degree remotely right now from Northeastern. So we've got a bit of a history with the college.
What were you studying at Northeastern?
Biology. Yeah, I was a biology major, and really, it's what I enjoyed. I really feel like Northeastern allowed me to build a good foundation for study habits, work ethic. I worked the whole time I was there, after school and on weekends, and kept pretty busy. But yeah, biology. I minored in chemistry, but my main focus was biology.
Did you pursue any business courses over your educational career since what you're doing now seems to be more concentrated on the business end of
Right. Uh,
operations?
Oops, sorry. Yeah, a lot of no, I did not. A lot of the training that I had was certainly in the hard sciences. I was pre-optometry, and then in optometry school, of course, it was all clinical training. We did have some practice management training while I was there. However, when I began working with a company called Luxottica, there was a focus on training what we called emerging leaders. And so I received a lot of more formal business training and informal business training through Luxottica throughout my career. So yeah, I've had numerous courses, and I've functioned on multiple executive teams for LensCrafters, Pearl Vision, and Luxottica in general. So I've got my business acumen, I guess you could say, the hard way, by doing and a little bit of trial and error, but certainly got some instruction along the way. So, and was fortunate to be able to work with some really wonderful people, as I do right now. I mean, we have a wonderful executive team at the Juniper Center, and a lot of folks that are not necessarily client facing or patient facing, but who really are responsible for ensuring that our clients get great care. That's really what we're all about.
Since you were in the optometry field so long, uh, right now you're working to help some clients that maybe for Bridging the Gap Collective, helping
Yes.
clients that may not be able to pay to
Mhm.
find clinicians that could help them. What about when you were an optometrist? Many people need uh, an optometrist care, and then how any resources that you could provide uh, any insight for resources for people that need optometry care?
Yes, absolutely. So to your first question, I went on many optical missions throughout my career through our at Luxottica, our One Sight Foundation, which was our charitable arm. We did some things back in the day, like outreach. We did have a scholarship program. We helped with interns. However, the biggest focus was really both domestic outreach, both domestically and internationally. So I've been, for example, to missions in the Philippines. I've been to Tunisia in North Africa, twice to our children's clinic in Mexicali, Mexico. But have also been part of numerous domestic missions where we've gone into the inner city in Chicago, working through Chicago Public Schools and CCIS, doing mainly doing eye exams on kids, making sure that they get the glasses and the eyewear that they need. Certainly, I mean, I've been to Detroit, been to New York for missions. We've done, really quite a bit to focus on kids' vision through our optometry focus, simply because kids they don't always know. They're not always going to raise their hand and say they can't see. But it comes out in other ways. They tend to not do as well in school. Kids who have uncorrected vision or refractive error tend to have challenges, and we may hear that the child is incorrigible, or they're not focusing, or they're not paying attention in class, disruptive, and so on, when all they need to do is see clearly. A lot of the kids that we were seeing were Medicaid eligible, but unfortunately, for whatever reason, parents, they just didn't make it to the eye doctor. So rather than waiting for them to come to us, we were going to them and providing free eye exams and glasses. So there is a resource there to this day for folks who can't necessarily afford eye care. There are also resources through the American Optometric Association, checked yearly. There are optometrists throughout the city here who will often donate their time very graciously in office, or going into other, doing vision testing and participating in health fairs to help reach out and help folks potentially identify some vision problems that may be occurring. And it's not just relegated to vision. I mean, eye health is so important to us, and it's the one, I think, sense that most people fear losing and really do take for granted. You don't want to wait until your eyes are until your vision is blurry in order to go get an eye exam. We recommend as optometrists that you have your eyes examined every year. We do a lot of checking both inside and outside of the eye, testing for diseases like glaucoma and cataracts, macular degeneration, and some more silent conditions that don't necessarily affect vision until it's too late. So it's really good to get checked every year.
The one side, the foundation and Luxottica, how do you spell Luxottica? And so are they, were you meeting the young patients at the CPS at the schools?
So Luxottica is spelled Luxottica, and the One Sight Foundation, ONESIGHT Foundation,
Mhm.
through Luxottica. And by the way, the foundation has been able to function through the generosity of various vendors and individuals who really saw the need for greater access to eye care in urban areas like Chicago and also internationally. In the city, yes, we did go down to some of the schools, Chicago Public Schools, Chicago Northside High School. We went into the old Cabrini Green, which is now an educational facility, all in the effort. And we had, by the way, a 40-foot mobile eye care facility called our Vision Van. So we would essentially bring all the tools, the instruments that we needed to measure vision, check for eye health, and dispense glasses right there to them. And we'd park right in the school parking lot, and kids would line up, and we'd see them all day for several days. So it was really a nice experience, a lot of fun. And it was particularly cool to go back year after year to some of these sites and see some of the kids who had really improved in vision and improved academically. And of course, they remembered us, and it was really just it really is a lot of fun. It's very gratifying. So and again, I mean, back to bridging the gap. We are looking to do the same thing with bridging the gap, not just with kids, of course. Although we do, we will take care of children who have issues with behavior and depression and other things like that. But we're also really trying to get into communities and meet the need. A lot of what we're doing right now is virtual. Telehealth, since the pandemic, has really become a mainstay for medicine, and particularly for mental health, has improved access to mental health services tremendously. So a lot of what we're doing through Bridging the Gap is connecting with people one-on-one. Usually right now it's virtually, and helping them get the care that they really need. I think what we find when we go into various communities is, people may have access and don't know it. There may be some barriers to care. So some are financial, some are cultural. There is certainly a stigma that exists out there that can be, I think, more pronounced in some cultures maybe than others. Some of it's generational. I think we find that younger people in general, and again, I'm just generalizing now, but younger people, Gen Z, tend to be a bit more open, a bit more ready to raise their hand, willing to raise their hand and say, I'm not okay. I really, I think I need some help here. It's trouble. I have trouble facing the day or whatever it is. Anxiety, depression is very common. We have the Center for Disease Control estimates that approximately 1 in 4 Americans suffers from depression on one level or another. So it is out there. It's rampant. And I think given all the circumstances that have surrounded, certainly the pandemic was a trigger, which I think caused a lot of people to really raise their hand, but also caused some folks to go over that sort of tipping point that really, caused them to reach out and ask for help. The economy, the whole global situation, geopolitical, and so on. I mean, there's so much that's going on right now that I'm honestly surprised more people aren't coming in for mental health care. But sometimes it's just a check-in. Not everyone is getting therapy ongoing. Some people are better after talking to people for several months or something like that. But we've got other clients who have really been struggling in their lives, and as I said, just for whatever reason, haven't sought care. We want to be there for them. And we do have some of those folks reaching out to the practice periodically. In fact, every week we're hearing from, we're getting calls from folks that say, gosh, I don't have insurance. I don't know where to go. Can you recommend somebody? And we're fortunately now able to say, you've come to the right place. We're here for you. And through interviewing the clients are able to do a really good match with one of our therapists who've been gracious enough to volunteer some of their time. So yeah, Bridging the Gap is really it's sort of in its infancy. We've been around for about a year and a half, but it really is, we're really getting some traction right now and have been able to reach out to now dozens of clients and help them get the mental health service that they need.
You mentioned that many people have that feel the stigma and do not come forward to to ask for help.
Mhm.
Is that more common than people actually coming forward to ask for help, despite the Gen Z and all of those generations coming of age?
I think there are a lot of people out there who need help, but maybe just don't recognize it and just sort of struggle through it. Some of it, again, as I mentioned earlier, can be generational. Folks of my generation are perhaps not as willing to raise their hands and say that, gosh, I'm feeling a little depressed. I'm having trouble getting through the day. I've got some anxiety. I think some of it was how we were raised. Has to do with, certainly as we mentioned earlier, a little bit with culture. We've done some work with a couple of inner city organizations outside of Bridging the Gap, and we happen to know that African American men, among others, do not raise their hands as readily as do others. So there's a group called Hip Hop and Mental Health that we've done some work with, and we're having some discussions with, and they focus primarily on, at least last year and earlier, we're focusing primarily on the African American community and males in particular. But I understand that they have now branched out to other communities as well, Hispanic communities, some of the poorer white communities. So they're doing some great work out there as well. There's enough for everybody. I mean, the demand still far outweighs the supply of therapists, and there's quite a waiting list right now for people to get into, even folks with insurance who can afford care, to get in and get the care that they need through a qualified therapist. Many, many more out there who, either recognize that they need help or don't, and just don't know where to go and what to do. So we do some outreach. We just attended in Rogers Park last weekend the Howard Street Chalk Festival. We set up a table and talked to people about mental health, and we're doing that throughout the city now, talking not just about Bridging the Gap, but also the Juniper Center, helping to educate people on a community level reaching out to community leadership to make sure that they are educated and helping refer people who may need some help and where to go and what to do. So yeah, we're trying to come out to the communities as best we can, and then we also have we've tried to get the word out through social media, through our own Juniper Center website, through the Bridging the Gap Collective website. And at the end of the day, slowly but surely, people are getting the message that they can come to us and we can hopefully meet their needs.
You go to special events and table at special events for outreach. Do you go to schools as well?
We have connected with schools virtually. We haven't gone out and, I'll use the word detailed, but gone out and met necessarily face to face with student nurses. But we're beginning to do more of that with our school nurses, excuse me. We're beginning to do more of that through our outreach efforts. Emily Dubach is our outreach coordinator. She's helped us a great deal, make some inroads into community organizations. Elise McFadden is our Bridging the Gap Collective Executive Director. She's been reaching out to community leaders really throughout the city, but now we're focused on primarily, in terms of community outreach in the Rogers Park area. There's plenty of need right here in our backyard to be able to connect with people. So, but schools are certainly next, as are other health providers, mental health practice, or excuse me, health practitioners in general practice, internists, everything from endocrinology to gerontology. There are folks who just, they're seeing people with mental health disorders every day and are needing to refer them out. And what we don't want is for somebody to go get in a queue that they can't, that's months long and not be able to get in. So we've got, fortunately, with our growth and the number of therapists that we've been able to affiliate with, a relatively short queue. So if somebody does need help, certainly if somebody calls the office, we get back to them within 24 to 48 hours, give them a sense for whether we can meet their needs or not. If for whatever reason we can't, we have an extensive list of other practices in the area that we can refer to. Not all of them provide complimentary or pro bono services as we do. But again, for those who are able to, who either have insurance or are able to afford it, we do want to make sure that if people can't get the mental health care that they need from us, they can get it somewhere and that they're being taken care of.
What about the patients that need mental health care, but also they have physical ailments and diseases that contribute to the depression, contribute to the mental health crisis? How could you help those people? Because they probably maybe their insurance won't cover the healthcare needs that they require.
Right. I think you've hit on an excellent point, and that is that mental health issues rarely exist in a vacuum. There are often other situations that can exacerbate those or make them a little bit worse. Certainly, people with, for example, weight loss, in need of weight loss therapy, or people who are overweight, people who are diabetic, older Americans who have begun to struggle a little bit with day-to-day functioning. There are a number of physical ailments that can also be accompanied by depression, anxiety. Certainly people, veterans. The folks over at Coffee and Hip Hop have done some work with first responders, and now we are doing work with first responders. But people with PTSD, those kinds of things are really, right now struggling. And unless they're going through unless they get into the VA and they know where to go, are at a loss to understand what to do and where to go. So we are really, a lot of times it does require a coordinated approach, one with the physician, to make sure that we're talking and communicating to one another. One of the benefits of having psychiatrists on staff Dr. Richard Shapiro is our chief medical officer, does a wonderful job of he and his team of communicating with our therapists and making sure that if someone does need medical management, they need medication for a psychiatric disorder, that we're treating the whole individual. So not just writing a prescription, but also doing talk therapy, psychotherapy, and if there are physical issues that are accompanying or coexisting with mental health, that we're getting the physicians involved and that we're having the right discussions on a team level to treat the entire patient, really physical, mental, socially, and otherwise.
Socially, you mentioned is sometimes it might happen that the environment, such as let's say people are living in a situation with mold because water damage often causes mold in ceilings or walls, and that's not easily repaired and alleviated. So people might get headaches and then have to deal with the smell of the mold and have to not be able to move. And that might lead also to mental health problems. And there's so much that goes on in addition to the mental health. Is there anything that uh, the Juniper Center and Bridging the Gap Collective can help these people address that portion of the mental health equation?
Hmm. Yeah, interesting point. I think, people who are in such circumstances, whether they're in a home that is not conducive to good overall health, let alone mental health, people who are homeless, who are without a place to stay. We're as through our work in community connection, beginning to reach out and through community partners, identify some of those folks who may need us and who may benefit from our services. So it's important that people know where we are, how to reach us. And again, we do that through social media. We do that through a number of different sites, our own websites. We try to get the word out and get into the communities to let people know who we are and where to reach us. Very important, though, that if someone has an issue like that, obviously, I mean, there are a lot of issues in play, but if somebody's got a problem with where they live, there are services that they, hopefully will need know how to reach out to. We can certainly guide in that way. We are not a social services agency per se. However, we do have many very capable, knowledgeable social workers on staff who can help guide people to get the care that they need that may be outside the realm of mental health.
Do you have case managers for the clients?
We the clinicians, the therapists themselves are doing the case management.
Mhm.
So we do have a multifaceted approach to the way we're taking care of our clients. I think within Bridging the Gap, I was just discussing with a couple of our board members last week the need for case management for some of those folks who are coming to us because we are realizing that their needs are that are multifaceted. They've got other things going on than perhaps some overlying depression, some other things that may be causing them to struggle throughout their day. And so case management is very important to ensuring that the holistic approach is there, that we're treating the entire patient, the entire client. Our psychiatric department and our therapists communicate regularly on every single client that our medical team touches. So if someone has a prescription for an antidepressant, they're not only seeing our therapists on a regular level, but they're also the psychiatrists, the psychiatric nurse practitioners, or our prescribers who are helping with the medical management, are in communication regularly with our therapists to ensure that we've got a good holistic and linked treatment plan. And that's one of the advantages of somebody coming to the Juniper Center or Bridging the Gap Collective is being able to be treated in one one place for hopefully all their needs, all their mental health needs, including medical needs if that's what they need.
How do you assess wellness? Because it seems as if you want to uh, you're concentrating on wellness, and then of course mental health plays into that. But so much of all that we have been discussing plays into wellness too. So when you describe wellness and when you're trying to address wellness, what how do you divide the different parts of wellness to address?
So we have, first of all, a fairly rigorous, I'll call it a triage process when someone reaches out to the Juniper Center. We've got a team of folks who head up what we call our access team. We used to call it intake, but we've rebranded it as access because that's really what we're doing is providing access to much needed for many mental health services. So initially, there's a bit of triage, some Q&A that goes on to be able to steer or direct that client to the patient to the appropriate therapist. But it really is the therapist who does the diagnosing and making sure that number one, there are mental health needs, and that they are in the right place, that we're right for them, and not everybody is. I mean, we don't purport to be all things to all people. But our therapists are very, very, and this is trained when they're in school, taught very rigorously in all the institutions, but ensuring that people are getting to the right place that they need to go. If medical therapy is needed, if prescriptions are needed to help manage some of their situations, we can refer internally when it's appropriate to our medical team, but also they're referring out for physical issues that may coexist with their mental health issues, and really taking part in a team approach to the care of those clients and patients.
When you mentioned that there is definitely not enough therapists to go around, is it on account of there are so many of these other factors such as health problems, environmental problems, economic problems that contribute to mental health that is making that is causing this dearth of therapists because there is so much other specialists that need to get involved to help make a person whole.
Yeah, very, very true. Very, very, very well said. So I think you've hit it on the head. The demand has really exploded, for lack of a better term. Um, the teletherapy, I think, has really improved access to care, and has allowed a lot more people, clients, to get care where they might not normally be able to. Somebody who's working a 9 to 5 or who may have multiple jobs may not be able to get away to be able to do that. So to be able to meet like you and I are meeting right now virtually, perhaps on a break, on their lunch hour, is really helpful for those folks. Some folks struggle with anxiety, I mean, tremendous anxiety, and might not normally get out and get into the office, which takes, by the way, I mean, when somebody to make a decision to seek mental health care is really, it's a heroic act for some, and to really be able to muster the strength and the vulnerability to be able to say, honestly, I need some help, is tremendous. So I do think that the focus on getting to as many people as possible is really, it's where we need to be. But yeah, the demand has really, and again, I mean, I think as we talked earlier a little bit about the stigma, it's not like so many more people have become in need of mental health services. I think it was out there, but again, people didn't always have the means. They didn't always have the will to do it. And through what we're doing right now, telecommuting, I think we've really opened up the door to a lot of people to be able to get the help that they need, and they're more apt, more willing, some folks, to be able to raise their hand and say, I'm not okay right now. So yes, I mean, the schools can't put out therapists quick enough to meet the demand that's ever growing. And of course, with the growth of the world population and everything else that's going on outside, it's it really is I'm not going to call it a race, but it is certainly a challenge to be able to meet the demands of as many people as is humanly possible, and that is really, really important. I'd like to go back to the issue of wellness just very quickly, because I think we've seen in other aspects of healthcare, in medicine, certainly in eye care, where I'm rooted, in dentistry, the idea of maintenance, of not waiting till you have a problem to go to the doctor, but rather taking good care of yourself in order to hopefully prevent or if not prevent, then help individuals manage through some of the more trying times in their lives, teaching coping skills and those kinds of things. And so the idea of wellness and mental health, you're reading more and more, you're seeing more and more about it in social media, the need to be present, the need for self-care. I mean, 15 years ago, 10 years ago, I don't know how many people talked about self-care. Now it's a thing. It's very important for people to take care not only of their physical well-being, but eat right, exercise on a regular basis, get checkups when they're prescribed, on a regular basis, go to the dentist twice a year, the physician once a year, but also taking good care of your own mental health and being able to recognize when there's a challenge, when you're having a problem. Don't be shy about raising your hand. The worst thing you can do is struggle alone. The best thing you can do is reach out to professionals who are able to care for these kinds of situations and treat these kinds of situations every day. So the idea of mental health as part of an overall wellness regimen is really, really important. And it's something that, fortunately, I think people are beginning to take into account.
Do you find that the clients are usually self uh, attending, self recognizing, and then seeking help, or is it usually a recommendation from another party, be it
It's a, it's a, mhm. Sorry.
a doctor or relatives and friends?
Thank you. No, it's a mix. So, people find us through a number of different channels. Some people do come to us from just, they've seen us on the internet. They've watched a program like this. They may have come to a health fair or an event like this past weekend on Howard Street a week ago, and have shaken the hand of somebody from our practice and have learned a little bit about maybe recognized a little bit in themselves what we've been talking about. So yes, people do self-refer, but also we do receive referrals from schools who as we talked about earlier, connected with on a virtual basis, hospitals from certainly from private practitioners who we've connected with, community organizations. So people are coming to us from a number of different avenues, and it really is a mix that way. And it's fortunate, I mean, that we try to, even though that there is a really great demand, and yes, we're very busy. On the other hand, we continue to do the outreach so that people know where to go and don't get lost in the shuffle, or just kind of ignore the symptoms that they may not even realize could be eliminated and help them feel much, much better.
How heavy are the caseloads now for the therapists versus how they what it was like a decade ago, maybe 2 decades ago?
Mhm. Mhm. I don't know that the caseloads have increased dramatically. And I think the reason for that is because therapy, I mean, again, I'm not a therapist myself, but I've had the privilege of being able to work with several dozen therapists. It's hard work. It is taxing, both emotionally, mentally, and perhaps even physically. I mean, if you're sitting for many hours at a time. So there is, for lack of a better term, there's a kind of a finite critical mass to the number of people that one individual can see. And our therapists they're wonderful, they're giving, they're knowledgeable, they're great at what they do, but they're also only human. So we have to be, I think, respectful of that. And in terms of client facing, hours in the week, that kind of thing. I mean, 25 to 30 clients a week for many therapists is about as high as you want to go. You start to get there are individual practice owners I know who see 40 plus, and what we don't want is for people to get burned out on what they do. Throughout healthcare in general, mental health is no exception. Burnout right now is rampant. I mean, it's in the news and you read about it, and it's among medical professionals, among any branch of healthcare, you're finding that people are getting burned out, and there are a number of reasons for that. Managed care it's very necessary right now. It's part of life, but making sure that that you're seeing enough people that you can make a difference and obviously make a living, but not so many that you're gonna dread getting out of bed in the morning, or Monday morning becomes an obstacle. There's a bit of a balance there, and we want to strike that. So what we are doing in our own way is continuing to grow with purpose, but affiliate with more therapists, more mental health therapists, so that we can meet the demand as a practice without overly taxing any individual therapist with seeing someone or seeing too many clients that pushes them beyond perhaps their boundaries, their own boundaries, and their ability to give good care.
Since we probably know more about contributing factors to mental health now, is it more difficult for the therapist, even though they're understanding better, since all these different factors come into place? Is it more complicated now to being a therapist versus before?
I think it is. I think the more we know, right? And the problems. If I want to be careful. More complicated, maybe. Certainly different. I mean, there are different challenges that are coming to light in modern society that weren't necessarily around before. Um, Social media has really played a role in mental health of late. And of late, I mean, beyond the last 5, 10 years of, issues with cyberbullying, issues with doom scrolling, issues with excessive video gaming. We have an excellent clinician, Andrew Fishman, who does some wonderful work with kids who spend too much time on screens. And I've got 2 sons myself, so I've seen that. The screens can be it can be addicting, and sometimes that's where they go for their socialization, for their own what they perceive to be for their own relaxation and mental health. Although I would argue that it's some of the games that they're playing are far from relaxing. So I'll use social media and sort of the digital world as a relatively new phenomenon that has caused a number of people to really seek out help. And we have had a number of folks that have come to us who are spending too much time on screens. The kids are coming home from school and they're immediately, they're on, now that tablets are being used in school, they're using, their world has shrunk to a point where they may be on screens for, half their day or more while they're in school. Then they come home and the first place they want to go is onto the screen so they can socialize with their friends and that sort of thing. And that has, come with, I think, a cost to the mental health of our younger people, and getting parents, of course, to, sometimes the electronic babysitter, it can be tempting, for you come home and you've got the kids and, they want to go watch TV or they want to get online and play games. It can be tempted to let the screens take over. But, encouraging those kids to get out as much as possible, get out in the sunshine, exercise a little bit. Very important, I think, for both physical and mental well-being. So I would say categorically, is it harder for therapists right now? I think initially I said, yeah, I think the challenges are just different. We're looking at different and perhaps new um, cause causative agents for mental health issues that maybe we weren't seeing in the past. But it's important that we get out there. The good news about social media is there's a lot of access to information, both for patients, for parents. People hopefully are learning to better recognize the warning signs when maybe there's too much screen time in their day and are seeking out the appropriate referrals or on their own cutting back a little bit and getting out and just living their lives away from the screens.
Mhm. But maybe sometimes there is some information that's false information, and that might detract them from the correct information that would help them.
Yeah, very, very true. There is a lot of false information out there, which is clearly another problem
Mhm.
of social media. It's access to information that may not be edited or audited or verified for facts. And hopefully, we're raising as first of all ourselves. I mean, we've got to be where we all have to be wary of what we're reading and what we're seeing online. And hopefully particularly with the election coming up, we're hearing a lot about fact checking. Hopefully we're doing our own fact checking as we're in the digital realm to make sure that we're getting the right information, that we're not succumbing to some of the marketing and some of the false information that's out there. Same thing with kids. I mean, we've got to teach our kids to be able to do the same. Don't believe everything. It's like in the old days, we would say, don't believe everything you hear. Now it's don't believe everything you see online. Double check, find yourself some reputable sources to go to. Make sure that you're looking at multiple points of view before you form your own, and then you can make an informed choice. Yeah, it's a good point.
When you train the interns that help out with uh, being with fulfilling the therapist need and bridging the gap collective, do you know if the interns are also apprised of the fact that to monitor their own mental health as well?
That is such a great point. Um, yeah, I think first of all, throughout all of healthcare, the schools are really good about helping their students realize that I mean, they know that the burnout factor is out there and how to take care of themselves. They're teaching students. I mean, who hasn't heard the term work-life balance? I think it means different things to different people, but makes a lot of sense to be able to train that earlier in their careers. By the time the students get to us, and first of all, I'm calling them students. The internship is it's kind of a bridge period between students and licensed clinicians. And right now we have five interns on our staff that we just started. So this is the fall, and we've got some really wonderful, bright, excited folks that have joined the Juniper Center for their internship. So they're going to get out there and begin seeing clients actively and under the supervision of our existing therapists. So we always have a therapist who's supervising that intern and making sure that they're debriefing the cases, making sure that their questions are answered real time. But yeah, those interns, one of the things that we're trying to help coach and teach the interns is, yes, honing their clinical skills is key, and that's really table stakes. But also teaching them cultural awareness, multicultural awareness. People are coming to us from all walks of life, and we want to make sure that we're hopefully exposing them to a number of different types of clients with different needs, different cultural norms, helping them to connect with their clients and patients on a human level and really establish trust. All very, very important missions for our internship. but also helping them recognize the need for self-care and self-help. And, the things that they can do, taking breaks throughout the day, talking to other people. One of the things that we try to provide at the Juniper Center is a real sense of community for therapists, helping them develop even beyond their internship phases and into their when they're actively licensed. We provide continuing education through our Juniper Center University. We have a new speaker every month, and therapists are able to get their continuing education credits or their hours of continuing education for license renewal through us, which we feel is a real value add. So we're trying to create an environment where our interns and our therapists can really bring their authentic selves to work, but we're also here to support and coach one another, because what we don't want is people being burned out. We want people to be really intent, yes, on what they do, but also that they're taking care of themselves as well as their clients. You got to take care of yourself first if you're going to care for others.
If there were students that want to apply as interns at the Bridging the Gap Collective, are they able to do so?
Yes, I would encourage folks to go to bridgingthegapcollective.org in order to apply. Our internship coordinator, Emily Dubach, can be reached at our front desk. The number to call would be 847 759 9110, and they will be referred to the appropriate extension. They can also do so through the Juniper Center, and our website is just thejunipercenter.com, and we've got links there that people can apply for internships. So absolutely. Right now, I would say our dance card is pretty full when it comes to interns for this season, but we will be taking on new interns next year. So yeah, I would absolutely encourage anyone who is at that phase in their career to reach out to us, and hopefully we can help and create an environment for them that is conducive to their overall development and getting to that next phase in their careers.
So in January 2025, it's open again for students to apply.
Yes, they can apply, and then they'll begin their internships in the fall.
If our listeners want to learn more about the Juniper Center and the Bridging the Gap Collective, where should they go?
Best place is going to be our websites. We try to keep them fresh and full of new and informative content. You can really get lost on our website in a good way, because we have many valuable links and ways for folks to learn more. But yeah, the Juniper Center, www.thejunipercenter.com for the Juniper Center, and we also have a link to bridgingthegapcollective.org on our website, or people can go to the website, the Bridging the Gap website, directly.
Okay. Thank you so much, Mark Jacquot, Chief Operating Officer of Bridging the Gap Collective and board member of the Juniper Center. Thank you so much for joining us on WZRD Chicago 88.3 FM.
Thank you so much. Bye-bye.